By far, knee pain is a very common problem in Asia, and that this is much more common than that is seen in the Western countries such as Europe and Australia. And so we think that it's likely that there is a strong genetic component to it. Common causes of this condition, how we diagnose the condition, and the various treatments available for osteoarthritis. Now then, by far most of these conditions are because of degenerative causes. But however, in some cases, it is important to rule out that any other causes. And one of the common causes for this condition is known as gouty arthritis of the knee. This condition, the patient may have a very high uric acid in the blood, or had history of gout, and that in these conditions there is excessive amount of uric acid in the knee, resulting in recurrent acute inflammation of the knee joint. So in these conditions, one will be able to diagnose this by doing a blood test to make sure that the uric acid is high. But by far the most common cause is because of degeneration. Now then, to understand this particular condition, we need to know the anatomy of this. In our knee, the joints are covered with this cartilage, and this is the kneecap. Now then, the cartilage can slowly with time gets worn away, resulting in ulcer formation, and together with development of osteophytes or bone spur, usually around the edges of the bone. In addition, there may also be release of debris and loose bodies that may float into the joints, resulting in formation of loose bodies inside our joints. Now then, what are the causes of osteoarthritis? Well, if we look at the anatomy of the cartilage, and the cartilage coats the bones here, and if we look at a cross-section of our knee joint, you'll find that the cartilage is actually quite thin. It's only about 4 to 5 millimeters in thickness. And at the same time, the actual substance is not particularly hard as well. Now, despite of these, the cartilage often for many patients will be able to last for 60, 70 years. Now then, that is quite amazing compared with how often we have to change our shoes and our tires, you know, that maybe, and many of these are usually quite, will only last for a year or two. But of course, we know that the cartilage is a living tissue. Living tissue being that it's able to regenerate and continue to grow. Every year it will continue to grow. So in other words, the more as we use our joints, the new cartilage tissues will form as a result of regeneration, and the regeneration is governed by the stimulation such as exercise and the use of our joints. Now if we look at the various different stages of this particular condition, you see there are four, broadly divided into four phases. At the beginning, you see that the cartilage is nice and shiny. With time, one would develop small cracks and fissuring of the cartilage tissues. By the third stage, you'll see that there are bone spur and at the developing, or bone spur or osteophytes developing at the edges of the bone, together with loose bodies that may be released into the joints. And the final stage, you see that much of the bone is being exposed and not much of cartilage left inside the knee joints. Now that's a diagrammatic representation, but if we look at what we see when we put a small camera inside the knee joint, this is what you see. Nice and shiny cartilage, almost like ceramic, you know, it's nice and shiny and white. With the second and third stage, you see that a part of the bone is being exposed and the surface is no longer nice and shiny. And the last stage, here you see that much of the bone is actually being exposed and with not much of cartilage covering the joint. Now then here on your left, you see that this is a normal knee, whereas on that of the right-hand side, you see that what the knee would look like when it's suffering from osteoarthritis. You see that the surface is no longer very smooth, and you see patches of the bone being exposed. So how do we treat this condition? Well, prevention of course is always better than cure, as we always say. Now then, there are many nutritional supplements available. Perhaps the most commonly researched supplement is glucosamine and chondroitins, and these do help to protect the knee joint and help the symptoms for those patients with early stages of osteoarthritis. Now then, despite this, many of the patients may suffer from acute attack of osteoarthritis. Now, how the patient would present would be that they can either present with gradual onset of gradual ache, feeling to the knees, especially with squatting and with climbing of stairs. Now, then there are some patients that may present with an acute attack of knee pain, and you see that the knee becomes suddenly very warm, very swollen, and in some cases one may need to remove the fluid from the joint in order to improve the symptoms. Now then, in addition to taking anti-inflammatory medicine and perhaps resting of the knee during the acute phase, one of the treatments that's quite effective for patients with early stages of osteoarthritis is to give an injection of a lubricant into the knee joints. Now then, this involves in giving the injection in the office settings, and that with this it will help to not only to reduce the friction as a result of the lubricants inside the knee joint, but it will also help to reduce the inflammation inside the knee joint as well. The lubricants will penetrate into the cartilage, and it will make the knee to last longer. Now, this procedure is done in the office setting. We would clean the skin, and then after that, then a needle is then placed into the joint, and the lubricant is then injected into the joint. It is done in the office setting, and that immediately after the injection, the patient is able to walk without too much of pain. Now then, for patients with moderate osteoarthritis, then particularly those patients with a lot of loose bodies inside the knee joints, then it may be useful to proceed on to carry out a procedure known as an arthroscopic washout. Now, what this does is that one would introduce the camera into the knee joints, and with this we will be able to drain all the inflammatory fluid out, and at the same time to remove the loose bodies inside the knee. Now then, for those patients with very bad osteoarthritis, so in other words, those patients with stage 4, where much of the cartilage is actually being exposed, and that with not much of the cartilage cover, then if one is looking for a permanent solution to this problem, then perhaps total knee replacement will be the treatment of choice. Because with this operation, it is a surface replacement operation, where one would replace the surface of the joints with artificial materials, and with this one will be able to be pain-free, and that are able to bend and squat much more freely, and it certainly has quite a long-lasting effect in that many of these patients will will last for up to 15 to 20 years. So this is quite a good treatment for those patients with severe osteoarthritis. And the analogy that one can give for this would be equivalent to, let's say, for instance, making a crown for your for a badly decayed tooth.